Under the stimulus of estrogen and progesterone, the endometrium undergoes cyclical structural modification, and there will be proliferative phase, secretory phase, and then menstruation phase. This cycle go on repeating again: proliferation, secretion, and menstruation. The duration of a menstrual cycle is normally 28 days. It begins with puberty and ends in menopause. In the proliferative phase or follicular phase, it begins with the menses, and it is characterized by the development of an ovarian follicle. FSH secretion from the pituitary increases and stimulus helps in the follicular growth. Growth ovarian follicles secretes estradiol. Estradiol without progesterone drives the proliferation of the endometrium. LH secretion increases after a few days. The positive feedback loop established causes estradiol to increase LH and FSH levels and leads to LH and FSH surge in the proliferative phase. Coming to the secretory phase, it begins with LH surge and ovulation and ends with menses. After ovulation, follicle is known as corpus luteum. This corpus luteum continues to secrete estradiol and begins to secrete progesterone. The negative feedback loop established results in where elevated estradiol and progesterone levels suppress the FSH and LH secretion. The LH and FSH secretion increases as the progesterone levels fall at the end of this luteal phase if there is no fertilization. And it also causes the development of secretory drugs in the endometrium. If no egg is fertilized, this decreased LH levels allows the corpus luteum to regress, leading to a decline in estradiol and progesterone levels. Decline also allows the FSH to increase, driving follicular growth in the next cycle. This is a picture showing the various estrogen, progesterone, LH and FSH surge and decrease in the different phases of menstrual cycle. And this picture shows tubular endometrial glands lined by tall columnar epithelial cells representing the proliferative phase. And this picture is showing the endometrial glands which are lined by tall columnar cells and with subnuclear vacuoles. And this represents the early secretory phase. And this picture shows late secretory phase consisting of sawtooth appearing glands and predecidual changes seen within the stroma. Now coming to symptoms of menopause: dyspnea, digestive problem, diaphoresis, hot flushes, headache, hair loss. Along with this, there will be bone and muscle pain, and there is a very severe emotional liability.